NEHAWU's confirmation that it will indeed go ahead with its program of action demanding improved PPE for frontline workers. NEHAWU says the program of action will begin on Monday with pickets as well as stayaways and will lead up to a possible strike on the 10th of September. Now, to look at the legalities of this action, I'm joined by Andrew Leve, who is a labour analyst. Good to have you with us this afternoon, Andrew. Perhaps let's take a look at what was said today. The fact that there will be various stages of this planned action, from a stay away, and if the requirements are not met, a full-blown strike in September. Now, we are still under the National Disaster Act, and we do know that healthcare workers are essential workers. What are the legalities and the regulations of them being able to strike during this time?
You know, the legalities of this are very, very murky. This is obviously all new territory. None of us have traversed it before, so we're not quite sure. If you set aside the national disaster regulations for a moment and you say, what is the position of workers who are regarded as essential services with regard to strike action? And the situation is quite clear. If you are an essential service, you may not strike. The matter must go to arbitration if it's a demand. Now, it's not always clear who is or who isn't an essential worker, but an employer, and that includes the state, can make application to a special committee set up in terms of the Labour Relations Act, whose job it is to determine whether something is or is not an essential industry. Now, I do understand that such an application may well have been made, but it not only raises the issue of what the legality is, and I'm going to come back to the state of disaster in a moment, but it certainly raises issues of a moral and ethical nature. And amongst those are, firstly, NEHAWU represents many, many people, from those who might work outside in gardening or cleaning services, to those who may work inside a building, but certainly not all are going to have exposure to the possible COVID virus. We all know that nurses and the like are exposed to risky conditions. One tries to minimize those, but nevertheless, in a manner of speaking, this is a matter of choice. They decided to go into that industry, and you could argue that there is a moral obligation to look after those in need. And because of that, you accept a degree of risk. Now, equally, for people who are not exposed any more than any other worker, in other words, not frontline workers in the wards dealing with patients, one would simply say, well, you know, why are you striking? Because like us, like everyone listening, we are all at risk to COVID. There's no additional issue for you. We now go on to a question of fact, and that is simply, have they or have they not got adequate PPE? And once again, that's a matter of fact. It's not a matter of opinion. There are qualified people, labour inspectors, people from the various health departments who can give an opinion, and that opinion should be ruled. Will we all be 100% safe 100% of the time, which is obviously the aim of any industrial or commercial safety policy? The answer is no. Life is not like that. So one really needs to look at it and say, we can never be 100% safe. Have we reduced the risk to a minimal and acceptable level? And if those who are tasked with making that determination say the risk is acceptable, I'm not sure that it's for any organisation, be it a trade union or the Mothers Guild, no disrespect intended, to say, well, it doesn't satisfy me.
Andrew, let's look at it this way. what NEHAWU has done is they put together a report where they went around the country analyzing the situation in different hospitals, and they put together a report with 7 recommendations and 7 key concerns, which they say they've presented to the minister. They've had various meetings, and none of their recommendations from within that report have actually been taken and used so far. So based on what they are saying, that there is not enough PPE, and this is also based on some of the conversations we've had with frontline workers who share their own personal experiences, that sometimes like a lady I spoke to yesterday or the day before spoke about having to use a mask that is used by mine workers, and she is a nurse. So she doesn't have the adequate protection that she needs for that specific frontline duty, which exposes her directly to COVID-19. So they say, NEHAWU, that they've made countless efforts to put all of these matters onto the table, and none of them have been addressed. So you spoke earlier on of their moral obligation, those who've taken this oath of office, who've chosen this line of service to save lives. But what about the other side? What about the moral obligation of the employer, in this case government, to ensure that their workers are also taken care of?
Well, it comes back to the point that I was making, and that is, excuse me, you can never be 100% safe 100% of the time. Certain jobs have inherent risk in them. Now, one takes, and the safety legislation says, you must take all reasonable steps. It may well be, and I've not seen their list of 7 recommendations, which may well be demands. If they're recommendations, why are they going on strike? 7 demands, it may well be that the minister has said, look, that is not appropriate, and we believe, and we've been advised by our experts, that what we're doing is adequate. It's a matter of fact. I can't answer that. I haven't seen, I haven't read, and I don't know what the content of the discussions were. But does the employer have a moral and ethical obligation? Unquestionably.
Part of the things that they require, for example, the obvious one of PPE, they require training, and adequate training for nurses and doctors. Those are just 2 of the things that they require. But what they have said is that should the stay away, not bring any fruitful results, should the motorcades not bring any fruitful results, by the 10th of September, they will completely withdraw their labor. So what they're saying is that they're going to be engaging the powers that be, and should those demands not be met, then they will go on strike. Do they have a legal leg to do this, or could this come back and bite them?
I think there's always the potential for biting in the back, so to speak. But I think one's got to be a little bit more focused in the issues, because clearly any court would take into account the degree of risk in the group of people striking. And clearly, if you work outside maintaining the grounds in a garden, and you have no more contact with the COVID sufferers than you or I would have, then one can simply say this is not an unacceptable level of risk. They may well say, however, for people who really are first contact, doctors, nurses, that the protection is or isn't adequate. I don't know. But if they are declared essential workers, and generally one understands the term essential workers as meaning that if you withdraw your labour, then the general population or a group of the population's lives are at risk. And that's clearly the case here. So if you are an essential service, and as I said, I think there's no question that the employer will make application in terms of the LRA to the Essential Services Committee to have them declared, or certain parts of workforce declared essential, and if needs be, will set or apply for a court interdict against those people striking. But at the end of the day, I would think that being a question of fact, and because of the implications involved, I would think it would best go to arbitration before a specialist board of safety experts, medical experts, who can hear the arguments, look what's happening on the ground, and make a determination as to whether it is or it is not safe. Now, that seems to me to be the best solution to a problem, both for government, for the union, and certainly for the public at large. And I must say this, I'm not convinced utterly that there may not be some other motive behind this. I mean, I know that NEHAWU were threatening to strike over pay in the national testing laboratories. Well, what are they doing at the moment? That's where all the COVID testing is done. Now, if our COVID testing program came to a halt at this point over a strike, I would really see that as an essential industry, and there are many, many arguments as to why not. Now, you did ask me earlier on, and I didn't deal with it, as to what is the situation with striking in terms of the National Disaster Act. You know, from memory, and I haven't read it for the last week, 10 days, I don't think there is anything at all in the National State of Disaster Act which deals with whether or not people can strike. But certainly, I would want to examine whether or not the National Disaster Act gives the state president the powers to prevent certain people going on strike. And I suspect that an argument for that could be made. But, you know, at the end of it, I don't want to suggest that there's an attention-getting device from either party. It just seems to me that we are looking at a matter of fact. It is or it isn't safe, that we've not heard the other side of the story, as it were. And what we need, I think, in a situation like this, is not necessarily a strike, but a mediation and or arbitration to answer the question at the heart of this.
And how does one circumvent this? The fact that in 2018 a resolution was made that there would be a salary increase that was due to take effect from the 1st of April. We are already now in what, September, August? Yeah, we're going towards September. And that hasn't happened. The 1st of April came and went, and there have been no salary increases. Those are part of the concerns that NEHAWU has at the moment.
Well, you see, it's using that as a stalking horse. It's hiding behind it and using the COVID thing as a means of pressuring. Now, the fact of the matter is that you cannot strike, not lawfully, over the non-implementation of a wage agreement, because it's what is called a dispute of right. It's not a dispute of interest, and you can't strike on a dispute of right. It's got to be arbitrated, judged by the court. Now, that particular dispute is already before the courts. It was referred 3 months ago. So the matter is before the courts, sub judice, so to speak, and we will get an answer. So it could well be that NEHAWU are in a state of great dissatisfaction. They're looking for ways of putting pressure on the employer, the government, this COVID thing is certainly a point of very, very strong leverage. If we walk out, what are we going to do with the people who are stricken with the disease, who the people may or may not have the disease? We can't test. For the regulation of how we deal with it without data on what's happening. And I would like to think that in a case like this, the public interest and the public good outweighs the interest of a much smaller group. So we'll have to watch that space. But I would not be surprised to find perhaps riding side saddle on this dispute about PPE, the dissatisfaction with the wage increase, and indeed it's been put on the table
it certainly has been.
Insofar as the National Health Labs are concerned.